Welcome to Maximal Being,
a podcast devoted to ditching fad diets and using real science to get you healthy and feeling great.
I'm Doc Mock, a GI and functional medicine doctor who harnesses the power of gut health to get you achieving your goals.
And I'm Jacky P, a well-informed layman who challenges the experts and asks the questions that you want.
Don't forget to hit the subscribe button or leave a comment.
And now, on to the show.
What's going on? Maximal Being's Doc Mock here with MaximalBeing.com. Don't forget to hit the subscribe button, leave us a comment. It does help us to get the word out. If you have any questions, you can email us at team@MaximalBeing.com. Enjoy the episode.
All right, everybody. It's me, Jacky P. Thanks for hanging on. I've been talking here with Dr. Scott Peslak and Kyle Smith about sickle cell. And, we've been kind of all over the map about sickle cell care and learning, right? Teaching folks what sickle cell is. And I like to take a little bit of a pivot a little bit and just talk about one thing I felt like about sickle cell, Kyle, and maybe you can chime on this as well, is there's something about sickle cell where you're dealing with not only the disease, but there's so many things, like it shockwaves into other parts of your life, right? From a more or professional aspect, for instance, I'm lucky enough that I'm entrepreneurial. I work for myself, but I know a lot of folks who are more in the corporate world, than they have sickle cell, and their superiors are not really understanding, hey, why are you gone all of a sudden for 2 weeks, with no warning? And then when you're back, why aren't you just 100%, right? So Kyle, as much as you would like to share, has this been something that you've had to deal with in your life? Is this something that you've seen in the community? What would be, some things you'd like to comment on that?
So fortunately, it's not something that I have to dealt with, or just because I have had very understanding employers, and I'm also very transparent about my diagnosis and disease, and understand that under the American Disabilities Act, I am protected, through my employment, and if I am missing any time, and if I just happen to get sick as well. Unfortunately, that is not everyone's case, and I do have a lot of friends who have told me horror stories, and about how they were in the hospital, and they were scared to pick up the phone because their boss was calling them repeatedly, about like where they were, when they would be back, how long they would need, so on and so forth. Mind you, they've been in the hospital for the last, 3 days trying to like really manage their sickle cell care pain. And also too, not everyone, like you said, is in the quote unquote corporate space. Some people just have like regular jobs that would that really demand physical labor too, right? Which is hard, for anyone, but especially an individual living with sickle cell disease, right? And I was talking to another community leader with sickle cell, and she said something that really resonated with me. She said, Kyle, having sickle cell is like having a full-time job, right? You have to really be so dedicated to your care, to understanding what it is you are putting in your body, to making all of your appointments, to getting to all your appointments and back, so on, to dealing with the pain, to dealing with what other complications you may be going through, so on and so forth. It's like a full-time job, right? So if you take that, and also you are working another full-time job, and maybe you are one of those people who, very commonly, especially in today's economy, has another job, whether it be part-time or full-time. You are literally saying that you have 3 to 4 full-time jobs, and one thing that we didn't really discuss about sickle cell is that another core component of sickle cell disease is fatigue, right? It's a huge deal, and it just is unfortunately something that is not always easily fixed when it comes to the different treatments and therapies that are currently available for sickle cell disease. But I mentioned the fatigue part because we all know what it's like after a long day at work, and
Mhm.
coming home and, whatever you do, if you take your shoes off and sit on the couch and you're so tired. But imagine having that feeling, a long day of work, just literally every day, just because of your disease. So yeah, that I think that if folks are unfortunately dealing with, the pressures of employers trying to really uh, enforce different types of rules and regulations of their jobs, please know that you are protected, and that it's illegal, for you to
Yeah.
get fired because of
Yeah.
your disease.
Yeah, and thanks for sharing that as well. That's one thing too. I forgot to mention. It's yeah, when you really think about, I tell people I've the like the Avengers of providers. I've got every type of specialty you think. I've got one. I see them regularly. Like there's a doctor's meeting, check-in, checkup almost bi-weekly, and it took me a while to realize, wow, if I had a 9 to 5 job, or if I was like an hourly employee, right? I'm grateful where I am, but this just the care, right? Not even, being in I'm air quoting the healthy phase of a sickle cell person, just the upkeep and maintenance can take a toll. And it's funny about uh I always call it kind of like the aftermath of having an episode. It's you're kind of sore. I like to work out, and I'd say probably for the last 6 years, it's like I have like amount of weights I can lift up. That's kind of like I know when I get back to it how long it's been since my last episode, because I get sick and then the amount I can lift goes all the way back down to zero and I rebuild again, right? And the other day I was at a board meeting, and I was still recovering from having some pain in my wrist, and I asked a friend of mine who's on the board to open a bottle of water for me, and he opened it for me and he laughed and he's like, man, Jack, you always have like some injury, right? And I didn't think about it. I didn't take it to offense, but I was like, yeah, like he doesn't know. I was like, yeah, that's sickle cell, man. I always got something, because last time I saw him, I was hobbling around because I had pain in my ankle, So outwardly, it's like, oh, Jacky's just probably clumsy. He just hurts himself. I'm 6'6". They just think I probably just don't know how to use my body. I'm running into things, but it's something that even when we're dealing with an episode, we have to deal with the episode. But even after the episode, we're still dealing with that episode.
Are you looking for high-quality, evidence-based supplements to support your functional medicine practice? Look no further than FullScript, the leading platform for healthcare practitioners to prescribe and order professional-grade supplements. As a functional medicine and gastroenterology doctor, I trust FullScript to provide me with a wide range of high-quality supplements that meet specific needs of my patients. Their extensive product catalog includes trusted brands, ensuring that I have access to the best options for my patients' health. That's right, FullScript offers a comprehensive selection of supplements, including vitamins, minerals, botanicals, and specialty formulations, all sourced from reputable manufacturers. Plus, their rigorous quality control ensures that you're getting products that meet the highest quality standards of purity and potency. And what I love most about FullScript is the convenience it offers. With their user-friendly online platform, I can easily browse, prescribe, and manage supplement protocols for my patients. It saves me valuable time and streamlines the ordering process. Absolutely, FullScript makes it easy to create customized protocols for your patients and track their progress. Plus, they handle all the logistics from inventory management to shipping, so you can focus on what matters most, providing excellent care to your patients. So if you're ready to take your functional medicine practice or wellness to the next level, visit us.fullscript.com/welcome/maximalbeing. That's us.fullscript.com linktree.com/welcome/maximalbeing to receive your 15% discount on customized supplements and check Maximal Being standardized protocols for gut health. FullScript has been a game changer for my practice, and I know it will be for yours. Don't miss out on this incredible resource for functional medicine practitioners and patients alike today.
So, I like to talk about as well the different types of treatment and the different things. So I personally just do the hydroxyurea, but I'm excited to learn and see how there's so many other treatments that are coming out and that are down the pipeline as well. So Dr. Scott, if you can kind of walk us through some of the treatments that are coming out, some of the things that you see that are on the horizon that are, giving some folks some optimism.
Sure, absolutely. So, Jackie, as you alluded to, and as I mentioned a little bit earlier, one of the mainstays for the treatment of sickle cell disease is a drug called hydroxyurea, and this is given to really the majority of patients with SS or S beta 0 thalassemia, another subtype of sickle cell disease. And at this point, we used to only use this in patients who had more severe episodes of pain, but we actually give this now standardly to children as young as age 6 to 9 months. And so this is, we found this is the one therapy so far that really can not only reduce pain episodes, but also prevent a lot of the long-term complications that we see in sickle cell patients, including kidney disease and risk of stroke and other chronic organ complications. And it's given in this different dose for each patient based on the patient's weight, and we titrate that we figure out exactly the right dose depending on what your labs look like and everything else. So again, it's individualized just like everything else about sickle cell disease, but this is something that I would definitely encourage listeners to talk to their providers about because it is a mainstay of therapy. But that's not enough for many patients. And we are working very hard in the field to develop new therapies. There are 2 other currently available approved therapies. One is a medicine called L-glutamine or Endari, and it's actually a kind of amino acid, so it's almost like something you can go to GNC and pick up, but it's in much higher doses and pharmaceutical grade, and helps to reduce some of the stress on the red blood cell. And that's a powder that's taken twice a day. And then there's another approved medication, IV medication, called crizanlizumab or Adakveo, and this is given through a vein once a month, and it helps to kind of reduce the stickiness of red blood cells. So, as I mentioned before, a lot of the underlying cause of this is that red blood cells can kind of get stuck in blood vessels and cause pain and cause decreased oxygenation. This helps to make the blood flow and the red blood cells a little bit smoother. We are the other main therapy that's out there that is available for patients and approved now, and we're offering at Penn as well, is something called gene therapy. And this is a approach that essentially takes your own blood cells. We take them out of your body using a specialized technique and add in a copy of non-sickling hemoglobin into the blood. And so effectively, we're able to transform the cells in your body from sickle cell disease to what's equivalent to a sickle cell trait, a carrier state of sickle cell disease. And so this is a great therapy, but the problem is that it's long, and it's essentially kind of a smaller version of a bone marrow transplant, except it's your own cells instead of somebody else's cells that you might think of when you hear the words bone marrow transplant. So you won't reject those cells, but it still comes with a lot of the risks, including risk of infection. You need to get chemotherapy in order to actually get those cells back in, so there's a risk of fertility risks, and even a very small but secondary risk of cancer related to that as well. So we're making a lot of progress in the field to deliver this in a safer and better way. It is a very safe therapy, but it is a long process, and so it's something that patients and the community should know is an option, but we want to talk to your provider about that as well. I'm really personally excited about some of the new drugs that are coming out to help treat sickle cell disease, many of which I mentioned I study in my lab here and many labs across the country. One of the ones furthest along is a drug called mitapivat, and this is a pill that helps to increase energy in each individual red blood cell and makes it less likely to undergo sickling and less likely to undergo vasoocclusion. and overall improve the health of those individual red blood cells. And so that's in phase 3 trials, which is the kind of the final phase of clinical studies. And so far the data looks really good, but we're excited about that as potential therapy in the next year or two that might be available to our sickle cell community.
Oh, that's exciting. And and you mentioned this, Kyle, when you spoke at the superhero soiree about learning. You tasked the audience there to learn, right? To learn more. Because you mentioned, you said, hey, if you think you know everything about sickle cell, the doctors and the professionals, right? The Dr. Scott Peslaks of the world are still learning about it, and they're still learning and trying to uncover these new treatments. And I think that really resonated with me as well, because one, just from a higher standpoint, no one knows everything, but two, you task everyone, not just the doctors and the professionals, but every individual to learn about it. And I'd like for you to kind of comment on that, right? Like what you spoke for a while, and I mean it was a great talk, but why would you encourage individuals with sickle cell or not to learn about it and to keep learning about sickle cell?
Yeah, no, for sure. I think that to kind of go back to your earlier comments, I was tasking folks to I want sickle cell to be everyone's disease of choice. I want for whatever disease that folks that are listening to, whatever disease that first pops up into your mind, I want to replace that with sickle cell disease, right? And I think it's imperative because sickle cell historically has just been incredibly neglected and marginalized disease. We were talking about hydroxyurea. Hydroxyurea was introduced in 1998. And originally it was a medication that wasn't even developed for individuals with sickle cell disease, right? It was originally, meant to be a cancer treatment, right? So again, when we're thinking about diabetes or cancer or, HIV, think about all of these different diseases and think about all of the different treatment options that they've had. Until 2019, sickle cell disease only had hydroxyurea. Now, I'm not the best at math, but I believe that is 21 years, right? One treatment in 21 years. And it's shameful, it's just so tragic to think about one of the oldest genetic diseases that is studied to create treatments for different diseases has only had one treatment in 21 years. And now, fortunately, we have two more and also, gene therapy option. Those treatments and therapies aren't for everyone. This isn't a one size fits all. And recently, sickle cell disease community experienced another tragedy in a withdrawal of a medication that was out and FDA approved in 2019. It was 3 weeks ago, 2 or 3 weeks ago, it was withdrawn. And sickle cell warriors who were on this medication, including myself, can no longer access this medication, right? And will never be able to access this medication because the pharmaceutical companies deemed it to be unsafe, even though it was FDA approved, even though it was it was on the market for 5 years, so on, close to 5 years, so on and so forth. And again, this is another just tragedy that this disease has experienced. And I just think that, if people really take a closer look into sickle cell disease and the history of this disease and its treatment and its neglect in treatment, I think people will find hopefully some type of moral will to try to aid individuals who are part of this community, whether they be someone who is living with the disease, whether they be someone who is caregiving for the disease, whether they be a provider, whether they be a researcher, so on and so forth. So yes, please, just continue to learn. Please continue to share, because that's really how we've been able to have, the progress that we've had so far.
And
Wow,
just to add to
wonderful.
that, if you could, if you compare this to other disorders, right, in terms of the amount of funding and the amount of research, it is a fraction of what has been committed to, if you compare this, say, to cancer, and you said to the cancer community, we only have two or three treatments, but yeah, that's enough. Nobody, that would not fly, right, and that should not fly in terms of what we're thinking about with sickle cell disease as well. I agree completely with Kyle that it is really an emergency, and comparing this to, say, other diseases where it's life threatening, this is absolutely life threatening on a daily basis for our sickle cell patients, and finding ways to allow our patients and community to live and thrive and be able to live their best possible lives. The only way we do that is with more resources, with more dedication, and that's bringing more interest into the field, in every level, in the community, among patients, among advocates, among researchers, but also really making sure that we push forward to understand sickle cell disease at a very basic level, and this is what we're doing in the field to prevent these kind of withdrawals and these kind of long-term complications and issues from happening to our community.
Yeah. Thanks for adding that. It's, one thing I am eternally optimistic about is the growing, I'd say, community that we have that's pushing for this, and the more visibility that we're getting. We didn't touch on it, but I forget what the TV show was called, Supercell, right? That just came out
Yeah.
not too long ago. That had a little bit of a subplot line of sickle cell, and so we're on our way, brick by brick, as they say. We're gonna get there, and I know if we got folks like Dr. Scott and Kyle in the mix, it emboldens me as well to know, like, hey, we got the right people for this fight, and to grow the awareness.
Are you a healthcare practitioner searching for a comprehensive solution to streamline your patient referrals and improve collaboration with other practitioners? Look no further than Rupa Health, the ultimate platform for integrative and functional medicine practitioners. As a healthcare practitioner, I've struggled with the traditional referral process for labs. It's time-consuming, inefficient, and often lacks the necessary communication between providers and patients. But ever since I started using Rupa Health, everything has changed. That's right, Rupa Health is revolutionizing the way that practitioners connect and order lab work with their patients. Their advanced platform allows you to effortlessly send and receive patient lab referrals and secure their information, sending them the kits directly. This makes the communication directly with other patients and practitioners easy to take care of. I can't stress enough how much time and energy Rupa Health has saved me. With just a few clicks, I can easily order lab work and track their progress, and then I receive the results directly into my inbox, which I can send to the patients automatically with recommendations. Absolutely, Rupa Health's extensive network of lab testing and curated, integrated, and functional medicine testing allows practitioners to receive the highest quality of care and dedicate their practice to a patient-centered, holistic approach which aligns perfectly with the values of healthcare in a functional medicine practice. Plus, Rupa Health provides you with excellent customer support. Their team is responsive, knowledgeable, and always helps with assistance in billing questions and how kits are shipped to your patients. They are dedicated to helping practitioners like us provide the best possible care for our patients. And if you're a patient listening, it allows you to seamlessly order your lab testing and receive all of the necessary information. Rupa Health has been a game changer for my practice, and as you know, it will be for yours too. Don't miss out on this incredible opportunity to save on lab testing by heading to labs.rupahealth, that's rupahealth.com/store/storefront_V as in Victory, G as in Grape, X 00400. That's labs.rupahealth.com/store/storefront_B as in Victory, G as in Grape, X0040. I'll see you later, Maximal Beings.
We have a few more minutes here left, so I'm going to switch gears slightly and do our 3 questions. And I just realized, I don't know if I can confirm with you guys, but we usually do 3 questions with our guests, and we'll just kind of go around very quick and easy. And there might be a bonus question because sometimes I throw random things in there. So Dr. Scott, you're going to go first. What is your favorite exercise?
My favorite exercise, I think my personal favorite exercise, so this is something, and it's something because I can do it with my family, is maybe people wouldn't consider it exercise, but I really enjoy golfing. And the reason is my 11-year-old daughter is learning how to play, and so is my wife. And it's something that you can actually, it's a low impact sport. You can play it at any age with any group of folks, and it's very social, and also allows you to really engage in the community. So that's my favorite. I guess if you want a more active sport, I really enjoy tennis and racquetball as well. But I would pick golf if I had to pick a sport.
Dr. Scott, you're in good company. I just started playing golf. I mean, it looks like I just started playing golf. I've been playing for 4 years, but I'm still terrible. And I play with my son as well. And he's 5. Shout out to my little homie. But racquetball is my non-golf favorite sport. So we'll have to talk about this too. And you're local.
Sounds good.
Yeah, that's awesome. Kyle, what about you?
Favorite exercise? I mean, I'm usually a gym rat, but I really enjoy anything that can get my cardio going, whether it be and low impact too. So, elliptical, the bike. I loved spin classes. I think I used to hate spin, but I still hate spin, but after the end and you realize how much you love it, right? So, but yeah, anything that really gets my heart going.
Yeah. Spin is kind of like golf because like you're pissed off the entire time you play golf. And you're like, why did I sign up for this? But then when you're done, you're like, oh man, I can't wait to come back to this. This was actually pretty good.
I agree with that. The 2 spin classes
yeah.
I've been with, I felt that way too.
Yeah. Awesome. Yeah. Also like spin as well. All right. So I'll let you take this one first now, Kyle. What is the craziest diet you've been on? If you've been on a crazy diet.
Yeah, I mean, the craziest diet that I've been on, I was really vegan based for a while. And I don't know if it was crazy, but it was the best I had ever felt, and I fell off the wagon and I'm back to eating meat and whatnot and enjoying that as well too. So I have no regrets, but no, yeah, I was really vegan based for a while.
Okay. What about you, Dr. Scott? I'm pretty sure or I guess you can also share, Dr. Scott, like any crazy diet you've like patients have told you they've tried because they read somewhere it helped them. Anything you've been on or heard of?
Well, I guess I can comment on one. I would say the craziest, I wouldn't recommend it for anybody, but the craziest diet that I've been on is being a third-year medical student because you basically had no time to eat. And so, I think I lost 20 to 30 pounds during my 3rd and 4th year of medical school. I would not, as a medical professional, I would recommend eating a very balanced diet and not doing that. So one lesson I've learned in my training is that no matter how busy you are, and how stressed you are, eating regular meals is really, really important because even though I lost a lot of weight, I was not feeling healthy. And since incorporating a more balanced and regular diet, that's been super important for me. So I would say I've learned my lesson on that one. But yeah.
Nice. That's a good PSA. Thanks, Dr. Scott. That's a kind of reoccurring theme we have here at Maximal Being that the scale doesn't really mean anything, right? I mean, it does mean to a certain degree, but you got to eat well, take care of yourself, be healthy. It's not just about calorie count. Doc Mock, always shares a story how he was, running 8 miles a day and only eating like 1,500 calories or something. And it was just like, and I believe he was also in medical school at the time, and he was just like felt terrible for a while.
Yeah.
So yeah, that's a good point. Next question. What is your, and anyone, if anyone has one, you could go first here. What is your favorite health book, if you have one?
I'll go. I don't know if it's necessarily a health book, but it's definitely, aligns with our conversation today. It's called Dying in the City of the Blues. And it's a book about sickle cell disease, specifically in Memphis. And it's wonderful. I can't think of the author right now. But yes, I'll definitely would recommend that.
And it said Dying in the City of the Blues.
Yes, Dying in the City of the Blues. And actually I have it
Okay.
here, and it's by it's called Dying in the City of the Blues, Sickle Cell Anemia and the Politics of Race and Health by Keith Waylu.
Whaloo. Nice. Okay, that's a good one.
Yeah.
I don't know, so Doc Mock usually has read almost every book anyone ever mentions on this podcast. So I'm very curious if he's aware of read it before. So I got to check with him. What about you, Dr. Scott?
I would, so I'm thinking of a broader term of health. I think a fascinating book that I'm sure many of your listeners have read is The Immortal Life of Henrietta Lacks by Rebecca Skloot. It's a really fascinating read, and I think for a lot of reasons. One is it addresses inequities in race and how that has played into science historically, and how we should really obviously be avoiding that in the future, and strategies to be able to do that. But also scientifically, it's really fascinating in how this one woman, Henrietta Lacks, essentially contributed to decades of scientific research in a way that moved the entire field in many different areas forward in a very profound way through the development of this cell line called the HeLa cells. It's a fascinating read, really scientifically rigorous, and addresses a lot of aspects about science, race, and the intersection of those in terms of understanding humanity.
Awesome. No, that sounds also fascinating. Yeah, those are two that definitely will want to check out. And for those listening, and I might be premature here, but I believe there should be a list of books that all of our guests have ever mentioned, because a lot of books have been recommended over the time, and these two particularly, I think I'm going to make a note to make sure I put on my reading list. And we have a couple minutes, so I'm going to do a curveball here and do one more question each.
Yeah.
So, Dr. Scott, you go first. Choose a number between 1 and 10.
Okay, do I say it out loud or do I think of it?
Yeah. It's not magic trick. Yeah, sorry.
Yeah.
We're
gonna say 9.
9. Okay. I just randomized some questions here. Okay. If you could have any animal in the world as a pet with no harm to you or the animal, what would you choose?
Wow, that is a deep question. Boy, I would say probably a dolphin. I think dolphins are fascinating. My wife loves dolphins, and I think that especially even not in isolation though. I think my answer to this would be any animal that I want would be a pair, because I think many animals by themselves are actually really, really sad and really depressed. And we see this even in the laboratory. And so I think I would want a pair of something, but I think dolphins would be fascinating to be able to interact with as a pet, but not in a environmentally unfriendly way. Yeah.
Sure. Yeah. No, good answer. Yeah. No, those caveat, no harm to the animal. Just the PETA folks don't come after us. It's just just for play.
Within their natural environment, but they're fascinating animals.
Yeah, just for fun. Dr. Scott is not a villain from the Bond movies. He's not going to put a dolphin in his pool in his backyard, right? So, all right, and Kyle, same. So now I know what the numbers are for, but 1 to 10.
Yeah, I'll choose 7.
7. All right. This is interesting. This seems like a heavy question, but we're going to go for it, and we can do a different one. If you had the power to erase one event from world history, which would you choose? And what do you think the impact would be? That's a heavy one.
Yeah, we can do a different one.
Yeah, that's a little bit light. Let's a little, hey, yeah. Here's the one. If you can take a glimpse of any time period for 1 year, past or future, which would you choose and why?
Past or future?
Yeah.
I mean, I would honestly, I'm just curious to see where we would be in the next century, so
Yeah.
100 years from now. I,
Yeah.
I want to see where, what what's health like? What's healthcare like?
Yeah.
What type of, are people what type of phone has Apple released where you can just kind of like look, through your contacts and, and contact lenses and dial up people and FaceTime folks that way. And yeah, I think I would be really curious to see also to just the demographics of folks and how that's changed and and also just I just love the idea of this politics as well and in different regions
Yeah.
and countries and whatnot. So yeah, I'll jump to the future 100%.
Yeah. That's a good question. I mean, good answer, excuse me. I don't know. And the question wasn't for me, but I've been thinking about it too. I am the same. I would love to see where technology has been. And, you know, I always think that AI at some point is just like our AI versions of ourselves are going to be dealing with each other,
Yep.
right? And like how will technology take over that? But then again, like I'm really nerdy and dorky and I like old things. So I would like love to have like seen the Colosseum in its heyday, right? I don't want to see anyone getting eaten by a lion, but just like filled with a roaring crowd and the chaos, or just, you know, seeing dinosaurs, right? How big a massive a brachiosaurus would be out. But yeah, cool. All right. Well,
Good answer to it.
I yeah, I appreciate you guys taking the time here out of your busy schedules and talking through this with me. Before we kind of sign off here, any last words, any brief comments you want to like say to the people that might be listening?
Yeah, so I will say that thank listeners for listening to this really important discussion, and I think that we as a sickle cell community want to be able to provide as much education, as much learning, as much awareness as we possibly can, and our goal is to try to engage as many people in the medical and the lay community as we possibly can. And so I would say if you're interested in learning more about sickle cell disease, please reach out to, I'm happy to talk to folks about this. I know that Kyle's organization is as well. A lot of advocacy, a lot of really strong, passionate people in the sickle cell research and patient communities. And so I would say that really try to be as engaged as you can with this incredibly important research topic and on the clinical side, because it really is affecting our patients on daily life and a daily basis. And we need more people, more smart and engaged and committed people in the community to be able to advance the mission of our patients moving forward.
Yeah. Yeah.
Thanks,
No.
Dr. Scott. And you, Kyle?
Yeah, no, absolutely. Agree with everything that Dr. Scott just said. And no, yeah, please check us out. Our website is crescentfoundationscd.org. That's SCD as in sickle cell disease, so Crescent Foundation scd.org. Our socials are Crescent Foundation and Sickle Cell Initiative on LinkedIn and Facebook, and then Crescent Foundation SCD on Instagram. But thank you all for tuning in and again, I'm going to task everyone to learn more and to share more about sickle cell disease.
Absolutely. Thanks, guys. So if you have any questions, please don't hesitate to reach out to us at team@maximalbeing.com. And if you haven't done so already, I'm doing my best here, Doc Mock, because he usually does this part. If you haven't done so already, hit the subscribe button, leave a comment, because it does help us get the word out. This is Jacky P, Dr. Scott Peslak, and Kyle Smith, and we're here to maximize our health. Have a good one, everyone.
The content included is not intended to be used as medical advice, and viewers should consult their physician or healthcare provider should they have additional questions. The viewers should not rely on information contained in these presentations for immediate or urgent medical needs. Additionally, if you think you have a medical emergency, call your physician or go to the emergency department or call 911 immediately. Never disregard professional medical advice or rely on seeking medical care or delay medical care due to information contained in this presentation. What's going on, Maximal Beings? Doc Mock here. If you haven't done so already, leave us a comment and hit the subscribe button. Let your friends and family know. That way we can get the word out and continue to bash the bro science.